Lactose intolerance is a common digestive issue that affects millions of people worldwide. This condition occurs when the body can't properly digest lactose, which is a sugar found in milk and dairy products. In a normal digestive system, an enzyme called lactase is produced in the small intestine. This enzyme's job is to split lactose into these two simpler sugars, which can then be absorbed by the body and used for energy. When someone is lactose intolerant, their body doesn't produce enough lactase to handle the amount of lactose consumed. When lactose isn't properly digested, it travels to the colon, where bacteria ferment it, causing uncomfortable symptoms like gas, bloating, diarrhea, and stomach pain. The condition can vary in severity from person to person, with some individuals being able to tolerate small amounts of lactose, while others react to even trace amounts. It's important to note here that lactose intolerance is different from a milk allergy, which is an immune system response to milk proteins. Lactose intolerance is surprisingly common, especially in certain populations. Worldwide, it's estimated that about 65% of the global population has some degree of lactose intolerance. However, the prevalence varies significantly among different ethnic groups and regions. For instance, lactose intolerance is less common among people of Northern European descent, affecting only about 5% of this population. On the other hand, it's much more prevalent in East Asian populations, where up to 90% of adults may be lactose intolerant. In African American, Hispanic, and Native American populations, the rates typically range from 60% to 80%. Types and causes of lactose intolerance. There are several types of lactose intolerance, each with its own causes and characteristics. Number 1. Primary lactose intolerance. This is the most common type. It occurs when lactase production naturally declines with age in some people. The main cause of this is genetics. This is a genetically programmed process that begins after childhood when the body no longer needs to rely on milk as a primary food source. In people with primary lactose intolerance, symptoms often become noticeable during adolescence or early adulthood and tend to persist throughout life. In some populations where dairy consumption has been a significant part of the diet for thousands of years, such as in Northern Europe, a genetic mutation has allowed for continued lactase production into adulthood. That's why they don't have a high prevalence of lactose intolerance. Number 2. Secondary lactose intolerance. This type is caused by an underlying condition that damages the small intestine. Conditions such as celiac disease, Crohn's disease, and inflammatory bowel disease can inflame or damage the intestinal lining, reducing the production of lactase. Number 3. Congenital lactose intolerance. This is an extremely rare form where babies are born without the ability to produce lactase. This type is apparent soon after birth, as infants with this condition will have difficulty digesting breast milk or formula that contains lactose. Number 4. Developmental lactose intolerance. This occurs in premature infants as the small intestine doesn't start producing lactase until late in the third trimester of pregnancy. In all of these types, the body has a reduced ability to produce lactase. Without sufficient lactase, lactose passes through the small intestine undigested and reaches the colon, where bacteria ferment it. The process of fermentation in the colon produces gases such as hydrogen, methane, and carbon dioxide, leading to symptoms like bloating, flatulence, and abdominal pain. The undigested lactose also draws water into the colon, which can result in diarrhea. Symptoms of lactose intolerance. Lactose intolerance symptoms typically appear within 30 minutes to 2 hours after consuming dairy products. The most common symptom is bloating, which feels like a swollen or tight sensation in the abdomen. This can be uncomfortable and may cause visible distension of the stomach area. Many people describe it as feeling full of air or like their stomach is stretched. Excessive gas is another frequent symptom. This can manifest as flatulence, often accompanied by gurgling or rumbling noises in the stomach and intestines. These sounds, known medically as borborygmi, can be quite loud and sometimes embarrassing in social situations. The gas can cause a feeling of pressure in the abdomen and may lead to discomfort or pain. Diarrhea is a common and often distressing symptom of lactose intolerance. The undigested lactose draws water into the intestines, resulting in loose, watery stools. This can lead to urgent, frequent trips to the bathroom. The diarrhea may be accompanied by a feeling of incomplete evacuation, adding to the discomfort. Abdominal cramps are another hallmark of lactose intolerance. These can range from mild discomfort to sharp, painful cramps, typically felt in the lower abdomen. The pain may come in waves and can be quite intense, sometimes interfering with daily activities. Some individuals with lactose intolerance experience nausea. This can range from a mild queasy feeling to a strong urge to vomit. While actual vomiting is less common, the nauseous feeling can be persistent and unpleasant. It's important to note that the severity of symptoms can vary greatly between individuals and may depend on the amount of lactose consumed. Some people might experience only mild discomfort after consuming a small amount of dairy, while others might have severe reactions to even trace amounts. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of lactose intolerance. To diagnose lactose intolerance, your doctor will ask about the types of foods consumed, when symptoms occur, and the nature of these symptoms. They might also inquire about family history, as lactose intolerance often runs in families. To confirm a diagnosis of lactose intolerance, doctors may recommend several tests. One common diagnostic test is the hydrogen breath test. This non-invasive test involves having the patient drink a liquid containing a standard amount of lactose. Over the next few hours, the patient breathes into a machine at regular intervals. If lactose isn't properly digested, it ferments in the colon, producing hydrogen that can be detected in the breath. So, an increase in hydrogen levels suggests lactose intolerance. Another method is the lactose tolerance test. In this test, the patient consumes a liquid containing lactose, and their blood sugar levels are measured over a few hours. In people who can digest lactose, blood sugar levels should rise as the lactose is broken down and absorbed. If there's little or no rise in blood sugar, it indicates lactose intolerance. Stool acidity tests are sometimes used, particularly for infants and young children. Undigested lactose creates lactic acid and other acids that can be detected in a stool sample. Treatment for lactose intolerance. Unlike some other digestive disorders, lactose intolerance doesn't typically require medication or surgical intervention. The most straightforward approach is to reduce or eliminate lactose from the diet. This means avoiding or limiting milk, cheese, yogurt, ice cream, and other dairy products. However, it's important to note that dairy is a significant source of calcium, vitamin D, and other nutrients. Therefore, people who eliminate dairy need to ensure they're getting these nutrients from other sources or through supplements. Fortunately, many lactose-free alternatives are available today. These include lactose-free milk, which is regular milk with added lactase to break down the lactose. Plant-based milk alternatives like soy milk, almond milk, or oat milk are also options, though their nutritional profiles differ from cow's milk. For those who don't want to completely eliminate dairy, there are strategies to minimize symptoms. Hard, aged cheeses like cheddar or Parmesan contain very little lactose and are often well tolerated. Yogurt with live cultures can also be easier to digest because the bacteria in the yogurt help break down the lactose. Another approach is to take lactase enzyme supplements before consuming dairy products. These supplements provide the lactase enzyme that the body is lacking, allowing for the digestion of lactose. While not perfect, they can significantly reduce symptoms for many people. Some individuals find that consuming small amounts of dairy with other foods can help reduce symptoms. This is because other foods slow down digestion, giving the body more time to process the lactose. Similarly, spreading out dairy consumption throughout the day, rather than consuming a large amount at once, can be helpful. In cases of secondary lactose intolerance, treating the underlying condition often resolves the lactose intolerance. For example, if the intolerance is due to a gastrointestinal infection, it may improve once the infection clears up. At the end, living with lactose intolerance requires some lifestyle adjustments, but it's generally manageable. Many people find that once they understand their tolerance level and learn to manage their diet accordingly, they can lead normal, symptom-free lives. Now, we want to hear from you. Have you ever struggled with lactose intolerance or know someone who has? How do you manage the symptoms while still enjoying your favorite foods? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.